Hi everyone. So today I would like to talk about a very interesting topic, which is first aid management of needle pricks. Needles, it is a belief that needles are used mostly by medical personnel, be it lab scientists, be it doctors, be it nurses. Okay, we use this mostly, but sometimes you can also be in possession of it and you can be pricked, especially the one that is used. So I want to teach you, if you are pricked by mistake, if you mistakenly get pricked, what do you do immediately? Okay, to avoid infection, to avoid viral spread. Okay, because most people believe that HIV is only gotten through sexual contact. No. Or a hepatitis is gotten through. No. All these infections can be gotten through other means, like sharing of sharps, like needle pricks. Okay, so today I want to also give you a practical example. I had a friend in school. So this friend, we were in students then, and we'd go on practicals in the teaching hospital. And one day we had an accident. We had an accident close to the school. It was a ghastly motor accident, and many victims were involved. Okay, now they brought these victims to the hospital immediately to A&E, and there were so much that the main staffs, they couldn't attend to them, so students had to join in. So him being a student, he had to join in also. He saw somebody that he knew, so the person was bleeding profusely. In a bid to help him, he got a suture and started suturing him. He started suturing because he had a bleeder. He was bleeding profusely, so he started suturing him without glove. So he was suturing him. Before he knew it, the needle pricked him. So when the needle pricked him, that was when he realized that he was not wearing glove. And then he withdrew back. That then it's like he was in shock, he was scared. Okay. Now we did everything. We did everything. They gave him the first aid, but he still had to take the PEP, the post-exposure prophylactic. He needed to take the HIV drugs, okay, for some time, because when they took the sample of the patient and then the sample of the victim and his own sample, the victim's sample came back positive. Okay, his came back negative. But you know that when it's HIV, when you have contact, you have to test like for some time, 3 months, 6 months. So you needed to be on the post exposure prophylactic before, and then he has to be running the test again. My friend was so scared. He got into depression, in fact, because it was not easy. Look at, imagine that kind of a thing. Like, in the bid to save a life, you have to go through that kind of a thing. The drug is not easy to take. For those people that take HIV drugs, like, it's not easy. Even if it is once a day, the drug is very big. So it's not easy to take drugs. Like, if you don't even like drugs, it's not easy. So they're taking these drugs. Like, he was praying and fasting. My friend doesn't go to church, oh, but he was praying and he's not going to church Monday afternoon night, because like hearing the negative news that he didn't wanted to hear that negative news that he was positive. That is the only thing that people don't want to hear, that they are positive for. You want, like, you are positive about everything. You want everything to go on well, but the result of HIV coming out positive is a problem. So my friend became so scared. Like, he became so scared. So he had to take the drugs for the complete 20 to 30 days. Then they started running the test. But thank God he came back negative. Thank God he was free from it. Okay, so that was a mistaken prick. But what do you do? What did you do for him? The first thing you do when you have a needle prick, a used needle prick, okay, you don't know whether this individual is exposed or not. So you put your hand on any area, affected area, under running water for 1 to 2 minutes. Why you do that is because you want to every germ, everything that is in the blood to go out. Immediately you do that immediately, and you press gently, press the blood out gently. Okay, or if it's a place where you cannot see, you just tell somebody to press the blood out gently, so that the water will flow on the blood and it goes out. Okay, now also the second thing you can do apart from the water, you use spirit, methylated alcohol. I told you alcohol kills a lot of germs. Alcohol, we use spirit in the hospital a lot. We use spirit at home. We use spirit for so many things. So spirit kills germs. It can sting you when you use it. It can sting you a bit, but it's very helpful. So you soak cotton wool and put it on the area. Okay, you dab it on the area like this, so that the germs can be free from the germs immediately. Okay, I told you squeeze out the blood gently. Okay, so that the germs doesn't go in. Keep the area clean and dry. Okay, do not repeatedly put the area inside the spirit, because the spirit, it delays healing. So as you do that, you just press it out, then use the spirit to dap it. Okay, so use spirit or water under running water. Use spirit immediately to if there's a virus or anything in the patient blood or anything, it cannot transmit to you. Okay, that is for a used needle. Okay, so now if the needle is rusted, okay, sometimes you might not know how to dispose this. You might not know how to. In the hospital, we have sharp box, but here you might not have a sharp box. Some people can drop it anyhow. So if it pricks you if it pricks you and maybe it's rusted, you can do this. You can also use the water or use spirit. But then again, because it's rusted, when it is rusted nail or anything that is rusted, you are at risk of getting a tetanus. So what do? You have to get tetanus shot, tetanus booster. So you go to the nearest pharmacy or the nearest health center to get a tetanus, one shot of tetanus, to prevent you from getting tetanus. Okay, and also if you do that, once you do that, I told that this is a first aid. You before you go to the doctors. Okay, because sometimes when you do this, swelling can continue, redness can be there, pain can be there, which means infection has set in. So you need to visit the doctor. You don't stay at home when you have a needle prick and you have a needle prick. So you don't stay at home with it. This is just a first aid treatment. So when you have a needle prick, make sure you go to the hospital. But before you go to the hospital, do all these things I've told you, so that you don't end up carrying the infection. Because the infection can be on the skin. It might not go to the bloodstream immediately to infect you. It takes time to go to the bloodstream. So by the time you do this, it will be better for you, so that you don't get any virus that you didn't bargain for. So thank you for now. I'll see you in my next video. Bye.